B, and many institutions, we are guided by public health advice and government directives. What you hear regarding rules, practices, planning, requirements, and expectations for the fall may be updated and revised. As we receive additional health and government guidance and direction, these directives could change. We want to provide an environment that enables you to learn and to live here. This has to be a safe place while a global pandemic and public health emergency is ongoing. Can you hear? Okay. Okay, yep. Well, so the way Ken's been doing it is he has his iPad up here and he actually scrolls through the questions himself and he reads them out.
Oh, I'm sorry, Dan.
No, it's okay.
I meant when he has multiple people up there that he can hear them.
Oh, got it.
If I'm explaining myself.
Nope, I do understand. So Kat, if you can hear what we're trying to test is if Ken can hear the other presenters.
Can you hear me now?
I can hear you, Kat. Yep.
Okay, so would be this would be one of the panelists.
Perfect. Yes, I can hear you loud and clear.
Okay, perfect.
And then we're just turning the monitor on to see what Ken can see. It's hard on these bright lights up here.
Ken can't see anything until we plug in his computer.
Got it. Okay.
So his computer gets plugged in. There's a HDMI cord. He knows exactly where to put it. It's labeled. So when he comes in, he'll just put his computer there and plug it in with HDMI.
Perfect. Yes, he has a whole routine. You should see him walk in.
Yeah.
So if we need to bring that down or anything like that, it's this guy. But for now, this is the level that so we'll start out. I don't think Kat was overpowering for you.
No. And Ken, quite frankly, Ken's hearing is not that great. So
I won't say anything. But I think that's a good level.
Too many years of concerts.
I didn't hear any feedback or anything like that.
Oh, oh, oh. All right.
life. For that I leave these sucker MCs. 3-2.
close till I get up. Time is barely on our side. I don't wanna waste what's left. The storms we chase are leading us, and love is all we'll ever trust. Yeah, no, I don't wanna waste what's left. And on we'll go, through the wastelands, through the highways, till my shadow turns to sun rays. And on we'll go, through the wastelands, through the highways, and on we'll go. mother told me when I was young, don't play with fire, be careful, son. But we were flames that fell in love. We burnt the cities down, down. Thought you learned your lesson. You won't be lonely if you fall in love over and over again and again.
Good afternoon, good evening, good morning for some of you. You join us from around the world, and it is so good to see you. I'm Ken Elmore. I am the Associate Provost and Dean of Students, and this is our virtual meeting to talk about the start of school. It is the 22nd of July. It is a wonderful evening here in Boston, and we wanted to make sure that we can answer as many of your questions as possible. We've got a few things that are going to be going on here. Momentarily, I'm going to give a few brief remarks, and then I'm going to ask you, if you have questions, to use the Q&A function of this Zoom meeting, and we are going to try to get through as many questions as we can. I will probably try to consolidate as many questions that might be similar so that we can move through them quite a bit. This is a session where we've invited guests from the Wheelock College of Education and Human Development, also the School of Hospitality Administration, and the College of Fine Arts. So we'll have some academic questions. We'll have some questions as they relate to the start of school and move-in. And of course, we'll have questions as they relate to what the start of the campus looks like by way of quarantine and testing too. So first things first, what I'd like to do is just to give you some opening remarks and make sure that we all are on the same page about expectations and commitments that we want to make. The university's made commitments designed to mitigate the spread of COVID-19 and also to support the well-being of this community as well as your well-being as a student. And we're talking primarily today about undergraduate students. The range and these commitments that we've made, and you'll hear about many of them, whether they be testing, limiting the density of people in our spaces, and other things that you will hear about, but also we'll see in the Back2BU guide that is available for you to take a look at. So as a student who will be living, working, taking classes on campus this fall, you will also have a critical role to play in minimizing the transmission of COVID-19 within the university community. So will I, so will your professors and the rest of the staff. So the university is requiring that you make your own commitments to safety as well. I'm going to describe a few momentarily, but it's important for me to point out that if you're unable to meet these commitments, the university expects that you remain off campus and complete your semester remotely. And that's an important thing to say. If you can't meet the commitments that I'm about to describe to you and that you might hear, then it's okay if you go remote, and we would expect that you would go remote. If you don't take this step, the university will prohibit you from participating in any in-person campus activities, including any campus activities, including classes and the ability to live here. So that's an important piece. If you are not going to go remote, if you need to, because you can't live up to these expectations, if we must, we will prohibit you from attending classes and participating in other campus activities. Let me give you the expectations that we have. We expect that you will follow all university health requirements, which include wearing a face covering or a face mask, physical distancing, hand washing, and sanitizing, and you'll hear more about all of those. We expect that you'll complete a symptom attestation every day. If you live on campus, you're going to do that prior to leaving your room. And if you live off campus, you'll do that prior to coming to campus. If you report positive symptoms on that attestation, you'll be expected to respond to the BU medical professional who contacts you for a follow-up, including following any instructions regarding testing for COVID-19. And we will also talk a little bit more about testing as a part of this conversation too. If you're required to undergo testing as a result of reporting positive symptoms, then you'll be expected to remain where you live and to minimize contact with others until a negative test result is obtained. We expect you to also schedule testing and report to an on-campus BU testing site for asymptomatic surveillance testing, and you'll hear more about that momentarily. And that asymptomatic surveillance testing will be based on an assigned test frequency that you will receive more information about. If you are informed by BU medical professionals or your own primary care physician or provider that you have a positive result from your symptomatic or asymptomatic testing and you live off campus, you'll be expected to isolate yourself where you live. And if you live on campus or in on-campus student housing, you'll be moved to an isolation space or an isolation housing, and you'll isolate there. Now, in order to leave isolation and return to campus, or to leave isolation on campus to return to your regular residence, you must be fever-free and symptom-free for 72 hours without medication, and 10 days must have elapsed from the onset of those symptoms. And if the university determines that you are a close contact of another individual in the university community who's tested positive, you will be expected to follow the university's directive to quarantine for 14 days. And if you live in on-campus student housing, you'll be moved to a quarantine housing space and will quarantine there. If you live off campus, you'll be expected to quarantine at the place where you live for 14 days. Please also understand that this information and these commitments and these expectations are based on public health circumstances, and university guidance and protocols will likely change. And one thing I've found is that they might change abruptly. And we hope that we will make sure that you are informed, and we ask that you keep yourself informed and follow any new guidance or protocols that we might give to you. So that's the introduction. What I'd like to do now is to bring in a few folks who are joining us. And as we bring them in, I'm going to ask them to introduce themselves. So let's go ahead and do that. And if you could give me the gallery view so I could see them a little bit better. Thank you. So let's see, I know that Provost Kennedy, go ahead and introduce yourself, please.
Hi, everybody. My name is Sue Kennedy, and I'm the Interim Associate Provost for Undergraduate Affairs. I work with the schools and colleges as they think about and develop your undergraduate academic programs.
Thank you. Peter, I see you there. Please introduce yourself.
Good evening, everyone. I am Peter Smokowski. I'm the Vice President for Auxiliary Services, and in that role, I'm responsible for undergraduate student housing, dining, physical education, recreation, and dance, and I will stop there because it's a pretty long list.
All right. Thank you. And I see Dr. Platt.
Hello, everyone. My name is Dr. Judy Platt. I am the Director of Student Health Services here at BU.
Thank you. I see Dean Fervuski.
Good evening, everybody. Yes, my name is Ellen Fazewski, and I'm the Dean of Student Affairs at Wheelock College and Human Development and Education, as well as a clinical professor in science education.
And Dean Chard.
Hi, everyone. I'm David Chard. I'm the Interim Dean of Wheelock College of Education and Human Development and Professor of Special Education.
Dean Upneja.
Hello, I'm Arun Upneja. I'm the Dean of the School of Hospitality Administration and Professor of Hospitality Management.
And last but not least, Dean Young.
Hi, everyone. I'm Harvey Young, Dean of the College of Fine Arts, and I'm also a Professor of Theater.
Fantastic. We also have a few people who are standing by in case we need to pull them into the conversation. They'll also be on the Q&A answering questions. We have people in the Q&A from the Office of Financial Aid, the Community Service Center, Disability and Access Services, Student Activities, and the Office of Residence Life. Now, what I'm going to do now is just start going through some of the questions that we have, and we'll do our best to get through as many of them as possible. Let's see, I'm going to throw this out to Provost Kennedy and the deans. Of course, one of the big questions that we get asked is, when are we going to find out and know whether or not classes are online or remote versus in person?
So I'll start, and then anyone can join in. This is something we've been working on for quite some time. The schools and colleges are working very, very hard to consider a lot of options. The default is the learn from anywhere model, but there will be a number of courses that will be in person only, and likewise there will be some courses that will be remote only. So that's an ongoing process as we consider pedagogical drivers and the needs of our faculty.
All right, and would any of you, Dean Young, Chard, or Upneja, add anything to that?
Yeah, I'll just add that on Monday, I held a town hall with all the faculty and staff within the College of Fine Arts. So we had a great conversation about, as you just heard, the blend. But the key thing to note is that, if you are on campus, there is a very clear on-campus in-person experience for the students within the College of Fine Arts. Next week, I will send an email to our community, to all of our students, to say, hey, here's what's happening. And that email will be followed up with individual emails from each of the school directors. So if you're in music or theater or visual arts, you will know and have a chance to answer questions, or have your questions answered rather, by both me, but also the directors of your schools.
And that'll cover a lot of those questions that I think we have about sort of in-person circumstances like theater and orchestra and those sorts of things. That makes sense?
Yes.
And I think, Dean Chard, it'd be a similar sort of thing. I'm in this sort of field, in this major where there's a lot of in-person and close contact. Will students receive a similar kind of response?
Yeah, the vast majority of our courses will be in the learn from anywhere mode, meaning there'll be a face-to-face experience for the students who are on campus or come to campus, and obviously same opportunities for people who are learning remotely. The one slight difference perhaps are some of our courses, as you know, interact with community organizations, schools and clinics. And we're having to work through each of those separately. In some cases, schools are under the same challenges we are in terms of limiting the amount of people in classrooms with children. So we're looking for alternative opportunities for those BU students who are taking courses that involve those sort of situations. We may be using video footage or other ways to help them learn to interact with children in the meantime, when we can't be in schools with them.
Complicated. Dean Fazewski, would you add anything to that?
I would agree exactly with what Dean Chard said. We've been working very hard these last couple of months, working with faculty, thinking about how we would prepare for the Learn From Anywhere model. And so we actually just had a panel today, and faculty are really thinking about what those courses may look like, making sure that the students who are in the classroom have the same experience as the students who are remote. So we feel pretty good. We know it's going to be a lot of work, but we're very excited about it. Actually, it provides a lot of opportunities for both the faculty and the students.
And Dean Amnesia, you're also in one of those spaces. It's interesting, all three of you are in spaces where it deals with individuals, people, and close contact. Same sort of conversation happening over at hospitality? And you're on mute, Dean.
Yes, thank you. So similar to what the other schools, vast majority of our classes are going to be in the dual modality Learn From Anywhere. I've already held one town hall for all of our students. I'm going to hold another one, and we'll send out an email shortly with the date for that next town hall. We've already held another one for the incoming freshman students. I've met them all in small groups. So all our classes are most of them are going to be dual modality, faculty in classes, giving instructions, and watch out for emails from the School of Hospitality in the next couple of weeks.
Thank you. Dr. Platt, of course, the big conversation is about quarantining and move-in. And I think that this is a conversation question for both you and Peter Smokowski. So people want to know, I am especially from a circumstance where I am in what people would consider a hotspot or some other piece of that, or my roommate is. And we are wondering, what are going to be the rules when I move in for quarantining? What's quarantining? What's isolate? What is all this stuff? So why don't I have you give it a go, and then Peter, we'll have you jump in to talk about how this all fits into the move-in process, please. Dr. Platt.
Thanks, Dean Elmore. A lot of really good questions. And despite all of the information that I think we're bombarded with on a daily basis about COVID, there's still confusion, and even sometimes healthcare professionals can actually add to some of that confusion. So let's start with one of those questions that you mentioned, the difference between isolation and quarantine, because that's actually really important to understand, particularly on our campus as well. Isolation is a little bit easier. Isolation refers to someone who has been confirmed to have a positive case, and that isolation means removing that person who is sick or unwell from other people who are well to prevent the spread of the virus. Quarantine is similar, but quarantine is a term that means you may be at risk. And there are really two types of quarantine when I think about it, that breaks down to easy categories. There's quarantine related to travel, and that quarantine is you're coming from an area that the United States or the state of Massachusetts has declared as an area of high transmission. And so you're asked to quarantine because theoretically, there's a risk that you may have been exposed. And I want to be clear that this has nothing to do with people's individual practices. Unfortunately, if you're in a certain state that's considered a hot spot, that's just, you're all sort of lumped together. So I want to be clear that sometimes that can feel like, well, you came from this place or someone else came from somewhere else. I mean, this revolves around individual can be practicing individual health practices in an area that's a hot spot and have no more increased risk of the virus than someone who's coming from an area that's of low transmission. So that's travel-related quarantine. We think that you should quarantine for a period of 14 days based on where you're traveling from or the mode that you're traveling in. Obviously, if you're traveling by public transportation, there is more theoretical risk that you could be exposed to the virus. And again, that's more in the theoretical and travel-related quarantine. The other type of quarantine is quarantine related to being a close contact. And that means that someone who has tested positive and is now in isolation, we've identified that you have been a close contact of that person, which puts you more in the actual risk of exposure and less in the theoretical risk of exposure. Now, the rules for both are still pretty much the same. 14 days from the time on which you've traveled or the time from which you've had a close contact exposure, you should be quarantining. I will mention that's in the absence of regular testing, which is not something that's been really rolled out in the United States to any great degree. So specifically how this relates to the move-in period. In Massachusetts currently, there are only 7 states for which a travel-related advisory is currently not in place. And those states are the New England surrounding states, Maine, New Hampshire, Vermont, Rhode Island, Connecticut, and New York and New Jersey, which means the vast majority of students coming from states outside of those areas and students who are traveling internationally would be recommended to self-quarantine. And self-quarantine really means that you minimize exposure to others, you try to limit yourself to your own room, and ideally, if you have your own bathroom, that's even better, and only leave your residence or your home to get meals or to get medical testing or to have medical appointments. So that's really what the self-advisory means. So in terms of people who are traveling back to campus, I would say a few things. One, if you're able to travel by private car, great. For many students, that's not going to be a reality. 2, practice the quarantine and individual health practices before you come to campus, because that's going to decrease your chance of testing positive once you come to campus. So a little bit of self-quarantine at home before coming to campus can really go a long way. And then 3rd, once you get to campus, the move-in process has really been carefully planned to not only de-densify the number of people that are coming onto campus, but also to allow for testing of students as they move in. And that will help us determine who needs to move into isolation housing if you're a residential student. And in terms of the quarantine, you'll be quarantining in your own dorm rooms, and it's up to all of us to really make sure that we stay put, stay in place, and do our best to minimize contact during that period of time.
And Peter, with regard to move-in, when I move in, how does this fit in with what Dr. Platt just mentioned?
Well, let me unpack that. Unpack, move-in, get it? Okay, listen, it's been a long day. So everyone, please bear with me. So we started with de-densifying the residences. We've reduced density. All of the quads have been removed from our system. All of the triples have been removed through our system. So we've reduced our density in the residences with the exception of 575. 575, affectionately referred to as Hojos, remains as triples because those are private rooms, and those 3 students, if there are 3 students assigned to those rooms, share a private bathroom. So we start with reduced density. And then we start with an extended move-in process that begins on August 15th and ends on August 31st. And clearly, if you're arriving later than August 31st, we will accommodate you. Just drop housing a note and let us know that you're going to be arriving a little bit later than you may have planned earlier. So that move-in stretched out, and the move-in by design is slow and steady. Slow and steady wins the race. We limit the amount of people that can, the number of students who can move in the morning and in the afternoon. So over the course of 15 days, 16 days actually, our campus population will gradually grow. As students arrive and check in, they will be required to do an entry test on the day that they check in. So you can see there are a lot of building blocks in place to ensure not only is it slow and steady, reduced density, reduced crowds, that's all intentional, so that, and then following up immediately with testing. And I believe Dr. Platt can correct me if I'm wrong, those test results will be available within about 24 hours. And so we've set the stage for a very structured move-in.
And Dr. Platt, what about the circumstance of a student who lives off campus who moves in and they've got to make sure that they're set before classes start? How's that going to work for them and what should they be doing?
You know, we focused a little bit on the residential move-in process, but Dean Elmore, to your point, this is something that all of us are doing, and the whole community may be coming back from areas, right, if people are vacationing. So in terms of what you should do if you're off campus, certainly the same rules apply around self-quarantine if you're coming from an area where there is a travel advisory in place. And I don't expect that to change too much in the coming weeks, but stay tuned because we know that things are changing, certainly related to travel-related quarantine. So in terms of testing, the testing obviously won't be right as an off-campus student moves in because there's less control that we have over that process. But the plans around testing, as Peter indicated, part of what's been really important about setting up our own testing lab on campus is to have a faster turnaround of results, especially as we see time to get results really stretching out in the United States with surges happening in certain areas. So we've designed a test that will be able to have results back in a relatively short period of time, and entrance testing will be happening for not just the students who are on or off campus, but for the entire community who's coming to campus. So the quarantine will still be important. And, you know, one test in time isn't really, you know, a pass that means, okay, well, that's good. It's really the serial testing that we think is going to be very beneficial in this case. And that's important because in the United States, for the most part, the type of testing that we've been doing is testing for people who have symptoms, and more recently, testing people who are close contacts. The type of testing that BU will be doing will be inclusive of that, but it will also involve surveillance testing, because one test in time, especially for someone who doesn't have symptoms, doesn't necessarily mean, doesn't give us as much information as 3 tests over the period of 10 days. And we hope to be releasing more information about the frequency of testing for our on-campus and off-campus students, as well as the entire BU community. But rest assured, the testing frequency will be fairly frequent because we know that those give us more data points to inform us about what's going on in our community.
That's really important that you say that. We're all going to be subject to testing, and that's a bit of an assurance for our faculty as well as for our students and our staff. So very important that we'll be a community of people who will be tested. Let me switch up a little bit. There are a few questions about what classrooms are going to look like. Provost Kennedy, can you give us a sense, general sense? And then I'm going to ask each of our deans a little bit about more specific questions about some of the classroom circumstances and practice or other circumstances that I see in the questions. So Provost Kennedy, general sense, classes, what should we expect coming back?
So they're going to look a little bit different. I think like a lot of our spaces on campus, we're going to use this word a lot, we're de-densifying. And that means in a classroom where you might have walked in and there were 30 chairs with the arm tablets, you might walk into that same classroom now and it might have 12 chairs. It might have 8 chairs. We need to observe that 6-foot distancing. So the classrooms are going to look a little bit different, and the creative spaces, the labs. Again, we've taken really good care to look at every room that's going to be used for instructional space or creative space, movement, and looked at it to see what the capacity would be while abiding by public health guidance. So it's going to look a little bit different, and your interaction with it will probably be a little bit different. A lot of classes will employ what we're calling rotations. So you may be going to class every other class, every third class. That will depend on the enrollment size as well as the classroom capacity. So it'll be a little bit different, but I think, to echo Dean Fizewski's sentiment earlier, everyone's really excited to have you back. Faculty have been thinking a lot about how to engage students in the Learn from Anywhere, so to engage both the remote and the on-campus students. And these are the same, world-class faculty members that you were working with in the spring and in the fall last year.
Thank you. And Dean Young, there are a series of questions about things like practice rooms and performance spaces. Can you give us any insight? I know you mentioned that you'll probably be sending something out very soon, but any insight here today?
Yeah, absolutely. So just I'll say three things, because three is always a good number, and then let me know there'll be more in my email, along with the email that comes from the directors of music, theater, and visual arts. Just at a large level here. For the practice rooms will be open. They will be available. If you think about the basement practice rooms at 855, all 110 practice rooms will be available for students. There is going to be increased rate of cleaning and sanitizing and cleaning all the surfaces. What we'll do is we will assign students to certain practice rooms to sort of minimize, the number of people who are in those spaces. We will schedule that as well. There was a note within the Q&A about a report, and what I did was I authorized the creation of a task force within the School of Music to offer some suggestions for how to actually do ensemble work, orchestra work, rehearsals, practices safely in a COVID environment. And that report is the reason why it's not sort of being emailed left and right, even though there's a draft of it, is because we want to make sure that everything aligns with the best safety protocols overseen by the university, the medical advisory group. So we're only going to move forward with those things that actually make sense and is consistent with our best practices and sound scientific evidence. So that's occurring. For theater, everyone wants to know, what does performances look like for theater? Well, we will have performances, but what we're going to do is we're shifting our plans, right? So we're looking at sort of smaller performances that require fewer people. But also, in addition to COVID, what's changed recently is there's been George Floyd, there's been Black Lives Matter. So this moment, in addition to COVID, has allowed the School of Theater to think about, let's actually champion new work by both students and also artists of color. So you'll find yourself doing a lot of new work that you might have experienced previously in the past within the School of Theater. And then, of course, within visual arts, we are de-densifying all of our studios. Students will still have access. They'll still have their individual studios to do their work. So that's what's happening. So it will look quite similar to it'll look quite similar to how it's always looked. But there will just be fewer people in spaces. There'll be more frequency with cleaning, and you'll have the confidence when you're in the building. You'll know that the people around you were tested frequently and in their room, and they tested negatively for COVID.
Dean Amnesia, what about things like internships and these other close contact things? I think folks want a little bit more information too.
So you are absolutely right that the School of Hospitality Administration, we require 2 internships, 400 hours each, but those are being held over a period of 4 years. So, and most of the students do take them over the summer. For those who are graduating or very close to graduating, we are making alternative arrangements with case studies and virtual interviews and some other methods to provide that experience. But otherwise, we are hopeful that most students will be able to complete their requirements with actual live experience.
And Deans Fizewski and Chard, of course, there are conversations about student teaching and wanting a little bit more information. I know same thing you said, we'll get a little bit more, but folks are really anxious about understanding what that might be all about too.
Yeah, it's of course, we're working very closely with the state of Massachusetts and the partner school districts and schools where we place practicum students. Our highest priority is on those students who are reaching the end of their programs and need particular kinds of practical experiences in order to secure, for example, teaching licenses. Many of our partner districts are eager to have student teachers back in their schools because they see that as an opportunity to help with the diversification of space and other issues they have as they return. Some districts, unfortunately, are not able to have student teachers or at least large numbers of practicum students. And so our Office of Professional Preparation is sort of mapping where it is we have opportunities. And again, our highest priority will be on those students who are at nearing the end of their program and are most in need in terms of staying on track in order to get their practicum requirements fulfilled.
So a lot of thought in all of these spaces. Fantastic. So Dr. Platt, there's a question about how we're going to deal with what might be mental health concerns, concerns about how people are going to be coming out of things like quarantine and isolation, but also being here and maybe having to do that again. Can you talk to us a little bit about some of those things you're doing with regard to that?
Absolutely. And I think it's really an important point to mention. I'm always glad when this question comes up on these calls. It can feel like all of healthcare is COVID. And of course, that is not the case. There are many aspects to well-being, not just physical well-being, but mental well-being, spiritual well-being. I mean, it means different things to different people. And I think we've certainly seen that one of the things that COVID has really pushed all of us in healthcare to do is more effectively and more efficiently deliver healthcare services via telehealth platforms. So for many students, we've been able to be in contact over the summer months when normally that wouldn't actually happen. So we've heard from a lot of students. We know that this has been very challenging. We also know that being in quarantine or isolation, which I think, you know, for many of us, the past few months have already felt like a quarantine state. So then to add on to that, something that feels even more restrictive can be really challenging. So specifically for students who need to move to quarantine or isolation housing, whether that is on or off campus, we will be reaching out to you daily to arrange telehealth visits. And when we've had students who really feel like they need additional services beyond the primary care health professionals, we'll hook people up with mental health therapists as well. And I think that's really important so that students know whether you're on or off campus, we're still reaching out to you. You're part of our community. We want to be able to provide support to you, recognizing that it is difficult. Throughout the end of the spring semester and even into the summer, we've certainly sent a lot of messaging around not just what behavioral medicine is doing within student health services, but the well-being project, where we really work to curate all of these health and well-being resources, mostly delivered through online platforms, but that students can take advantage of. I'd really encourage all of our students, actually not just our students, our whole community, because this has been hard for everyone, to take advantage of those things that you have found to be successful getting you through this period now. For some people, it may be doing 5 minutes of meditation. For others, it may be picking up the phone and talking to a friend. You know, social distancing has sort of taken on this meaning, but really what we've said here at BU is we want you to be socially close. We want you to be physically distant, but we need you to be socially close. We're social beings. So I would just add that all of the services that we typically offer through student health services will be available in the fall. We may be delivering them in a different way, and certainly we'll need students to have appointments before they come into student health services, but they're all available to you, and we encourage you to take advantage of them.
Thank you. Provost Kennedy, I had a few questions that pertain to the academic calendar and LFA, if we can take those. So the first question that comes up is, look, I'm looking in the news and I see all these schools that are saying somewhere around late November, we're sending everybody home and we're going remote. Is BU changing the academic calendar? And then the second question is, well, why not?
That is a great question. We have had a lot of conversations actually about the academic calendar, and as Dean Elmore had mentioned, there are a lot of conversations going on at other institutions as well. As of right now, and I think we'll have an announcement fairly soon, but as of right now, we are maintaining the academic calendar as it is at the moment. So that is classes going through December 10th, followed by a study period and final exams. That doesn't preclude students who decide to travel at the Thanksgiving period from switching to remote themselves. That is the LFA framework, the Learn from Anywhere framework, has that flexibility for students to be able to do that. So some students may choose to do that and not to return to campus. I would say, however, when exercising that option, it's really important to be in touch with your faculty, to be in touch with your school or college, and talk with them about your plans. We are working on an indicator that students will be able to identify their location, but it is not a substitute for talking with faculty and letting them know your plans.
And so LFA is that simple. We can make that change, but we should consult. But what if I've got a circumstance where a course that I've got is not being offered online? How should I handle that in the LFA framework?
There will be a number of courses that will be in person only. It's because a specific skill is being developed in that course. There are pedagogical reasons why that would happen. In some cases, the schools and colleges are creating adjacent courses for those students that would be remote. But you can work with your school or college, work with your advisors and faculty to talk through what your path should be. And I think there would be specific solutions based on the school or college and major that you're taking. So everyone is very aware of it, and we don't want to impede any progress toward the degree.
Peter, I would take it that if we're not changing the academic calendar, we're also not going to change the residential calendar, that we'll stick with what we would typically do in an academic year or a semester, right?
That's correct, Ken. Other than the extended move-in period, we would continue to host folks through the end of the semester. And I would just note that for many years, our residences have remained open over Thanksgiving. And we have also had dining facilities open for Thanksgiving. So this year will not be any different. We will probably expect a few more students to remain here over Thanksgiving. And we will certainly be prepared for that. We're in the market for turkeys.
Yeah. Well, talk to us a little bit more about dining. There are questions about dining. Are we going to have it? I hear this only grab and go. You can't sit there. There won't be lobster night. All these sorts of things. Talk to us a little bit about what we can expect from dining.
Yeah, well, our executive chef, Chris B, and his team, we just have an amazing group of culinarians in our dining team. They have been working all summer on the menu. And it's a 6-week menu cycle, very robust, very similar to the fall. And for students that have special nutrition or dietary needs, we will continue to work with the Sergeant Choice Nutrition Center. Just a great group of nutritionists there. There are 7 full-time nutritionists that work with students if they have allergies. The dining program is tied to that Sergeant Choice, and so we will work with individual students. Gluten-free dining will be available. Certainly, if you're a vegan or vegetarian, you will have numerous options. The gluten-free pantries will be open. As the dining hall experience, there will be reduced seating in the dining halls. It will be substantially reduced. So there will be a number of single tables where students, if they choose to dine in the facility, can do so. Every meal service will be freshly prepared, but it will be prepared and placed and served in takeout containers. So it gives students the flexibility, if they're comfortable in a dining hall, to remain in a dining hall and dine at one of the single tables. If you're a member of the household, then maybe we can get to the households and how we plan those small communities for the fall. There will be small table settings for households to dine together as well. So I think you can look forward to a robust plan, fresh. Also from a sustainability perspective, we're very focused on that. Local farms, local producers, all within 250 miles of campus. That's been a hallmark of our program for many years. So we will continue to do that. Lobster night, short of getting on the boat myself and going into the Gulf of Maine, there will be lobster night. We won't be cracking shells in the dining hall, unfortunately, But Chef B has a very special night planned for takeout lobster night.
And my understanding too is that some of the traditional cultural nights that we've had before will also still happen, but maybe in a slightly different format. Does that make sense?
It does. It does.
So Peter, let's talk a little bit more, and I would also say Dr. Platt as well. Talk to us a little bit more about this household concept. What's it really mean, and what are the implications for what I need to do?
Well, let me touch on that, but I'd also refer everyone back to the campus guide. You know, that is a 20-page document that we published several weeks ago. There have been a number of updates, and that is a very useful tool, just even for referral and for refresher if needed. So when we talk about households, we're talking about creating small communities, and that really is not that different. And I've probably said that a few too many times this evening, but if you're moving into an 8-person suite in 33 Aganis Way, your suite mates, you've already had a household. You already have schedules, your academic schedules, your extracurricular activities, and you work together to share that time in using those bathrooms for daily hygiene visits. So it really is more of a formalized process. So if you're in a suite or an apartment that has an in-suite bathroom, those households will work together to schedule access to those facilities. And as always, students have always been responsible for keeping those private units clean and for maintaining the sanitation in those units. That will continue. We will provide a starter kit for those students with disinfecting wipes so they can manage their use. And you know, and I think it goes without saying that as you use these facilities, you leave them as you would like to find them yourself. So you leave them in a good condition for the next person that's going to be using them. In the first year residences, and I think Warren Towers and certainly West Campus are good examples of that, those floors will be split into 3 or 4 households. And those households will be comprised of anywhere from 10 to 13 or 14 students. Depending upon the hall and the floor. And that will be require those students to work together both within their household and on a floor for, again, scheduling daily hygiene visits to the bathroom so that we can keep the density. Now those bathrooms will be outfitted with disinfecting wipes. Facilities will also be on enhanced protocols as they are, as Dean Young mentioned, as they are in the classrooms and in the public spaces and the common spaces. That will continue in all the residence halls. Facilities will be going through on a regular basis and doing deep cleaning of those bathrooms, the hallways, the elevator buttons, the light switches, the doorknobs. That will be ongoing. You will see a lot of that in the fall and throughout the fall. Now, for a student using those common shared bathrooms, you know, we're going to advise you use the disinfecting wipes. Wipe down the countertop, wipe down the sink area before you use it. And then when you're done, wipe it down for the next person. Again, leave it as you would like to find it. So it's really working together as a unit and using good judgment. I mean, I think Dean Elmore, you mentioned that in your intro letter to the Living on Campus Guide. And it's going to continue to be very, very critical. Your households will be a place where all of your your suite mates should feel safe. And there should be this level of cooperation that actually leads to compliance, if you will. Just exercising that good judgment, taking care of each other, as I think you've noted today and in previous calls, you know, supporting one another and being safe.
Dr. Platt, will there be a dashboard or anything of that sort that people will be able to get a regular idea about number of cases or other things that are pertinent here?
I'm glad you mentioned that, Dean Elmore. Yes, we will have a dashboard here at Boston University that will provide information to our community. And that's for 2 reasons. One, I think it's to give a sense of general awareness. And some of you may be familiar with this. It may be a dashboard that you see from your state or even from a county already. So BU will be having a similar dashboard where information will be shared so that we raise awareness, but it's also about being transparent. People have a sense of what's going on the campus. So the types of information that we'll share will be, obviously nothing will be shared that is personal information, but it will be the number of tests that we've done, the percentage of positive tests of those tests that we've done, number of students in isolation or number of students in quarantine, information about like that we look forward to sharing to keep our community informed.
And those students in quarantine or isolation, they live in different places from what other students are living in, right?
That's right. So for designated quarantine and isolation, those are specific units that we are holding around campus where students are physically separated. Designated quarantine housing, as we mentioned earlier, for that quarantine that involves someone who's been a close contact, that will be quarantine that will have a private room and private bathroom. And designated isolation housing will also look similar, although students in isolation actually are able to share spaces to a certain degree, whereas in quarantine, because that's not actually a proven infection, it's a little different. So those areas are distinct and around campus, and we'll work with students who live on campus to move to that type of housing when need be. And for students who are off campus, we'll provide information about how to safely quarantine or isolate at home or in your place of residence or in your apartment when those situations come up. Certainly anyone who needs to be in quarantine or isolation who may live close to campus or may be able to go home to a permanent residence by a private car or private transportation is absolutely welcome to do so. We won't, just like in usual situations, if someone's sick and would rather recover at home, they're certainly welcome to do that. But if not, we'll be taking care of you here on campus.
And if a student, and Peter, this may be for you, if a student gets some people to help them move in, how many people can they bring? Can they switch people out? And what's more, do those helpers have to be tested and quarantined as well?
Well, I don't believe that helpers need to be tested, but Judy can correct me if I'm wrong. When you think about the move-in, again, we've broken it down into smaller groups. There will be laundry carts available to assist students with move-in. The lower density in move-in means there'll be better access to elevators. Those laundry carts will be sanitized after each use. So from that perspective, I think we have we've essentially created an environment that makes move-in a little bit simpler and easier. We'll also have the support of the Scarlet Squad, those terriers that are out there helping, organizing, conducting, if you will, a move-in experience. And I think that from that perspective, we're pretty well prepared. And please bring one person. I think it's a student and one person. For the same reasons that we've extended the move-in and we've de-densified, we're trying to keep the crowds and the number of people coming in and out of the residences as low as possible.
And Dr. Platt, on a practical matter, how will I know when to get tested? Will I receive a direct communication? Do I get that at move-in? And certainly if I'm a student who lives off campus, how am I gonna know? How should I do this?
So those are great questions, and I think we'll have more information in the weeks to come. But in terms of how surveillance testing will work, yes, for residential students who are moving onto campus, that testing will occur in very close proximity to when students are moving in. But regular surveillance testing will be something that students will be prompted to go in and schedule. And the good news is, with so much that has changed, the way that students interface with Student Health Services has not. So this will be done, scheduling testing will be done through Patient Connect, which is the online portal that many of our students are familiar with, that you submit your incoming immunization forms to, but you can also use to schedule appointments within certain departments and message back and forth with providers. So students will be prompted to schedule their first test when they come or move in, and then they'll also be prompted as they leave the testing facility to schedule their next test.
And when you talk about testing and you talk about care, are those things billed or will health insurance cover it? How's that work?
So another great question. For all of the COVID-related care that is part of the Back2BU safety initiative here, which includes surveillance testing, as well as supportive quarantine and isolation, and daily symptom attestation with lots of support from triage nurse specialists, depending on how someone fills out that symptom attestation. That is all part of what BU is doing for our community. There will not be any charge to insurance. I do think it's a good question, though, just to think about insurance. You know, health insurance is always an important topic, and it certainly has become more nuanced this year because we may have students that are on campus or who are learning remotely right off campus, or maybe learning remotely, you know, on a different continent. So wherever you are, it's important to make sure that you have adequate health insurance that meets the Affordable Care Act requirements. And you can read more about that on our Student Health Services website. I'll put the address in the chat. All students who are incoming receive the health insurance guide to really help you make an informed decision so that if you need higher level of care, such as going to an emergency room or going to the hospital, that you don't have to worry about how that coverage is going to happen at the time of the event. You have that in place, whether it's for COVID or any other healthcare related emergency.
All right, I'm going to do a few things. First, I want to remind folks that we are not going to get to all the questions. We've got to start to wind down very soon, but we do have this brochure, that you should have received. If not, it's online in the Back2BU site. And part of why I'm pointing this out to you is there are a number of offices and services with telephone numbers, email accounts. If you have a question that someone may not have been able to answer in the Q&A or right now, you should call or email and ask these questions. Folks will get back in touch with you. The school and colleges, so I am sure that Dean Char, Dean Amnesia, and also Dean Young do not mind you emailing them or their offices to try and get responses as well. So do that. Make sure you get those. Don't sit around and wait. If you've got questions, you need some relief, you need some thinking, you need some advice, you might need a little leeway, contact the offices involved to see if you can get those. Very important. I also need to bring Amanda Conley in because we also have some international students who have some concerns and questions about things like F1 visas, extending them, the connection with LFA. So if you could just briefly give us an overview about some of those concerns and maybe things they should be thinking about as well.
Absolutely. So I'm Amanda Connolly. I'm the Associate Director for Student Services in the International Students and Scholars Office. We know that this has been really, really challenging for our international students for a variety of reasons. And in the last 3 weeks or so, it's really become incredibly confusing. And we have students who have an extreme amount of anxiety around, can they get back? What does the fall look like? Can I continue to enroll? What is going to happen to my SEVIS record? And we in the ISSO we're trying to get information out to you as much as we can, but things have been changing so quickly that we basically write an announcement to everybody and then something changes and we have to rewrite it. So we're trying to get information to you as we can. So kind of what I want to share with you guys is we have two groups of students. We have our continuing students. We have a lot more information right now about our continuing students. And we feel pretty confident saying, as long as you continue to enroll full-time, you continue to make normal progress in your degree program, so you're continuing to work towards your degree, you should be fine. We're gonna be able to keep your SEVIS record open. That's where your I-20 comes from. We're gonna keep that open, whether you're here in Boston studying, whether you're studying in your home country. We feel relatively confident saying that with the information and guidance we have right now. What we have more uncertainty about are our brand new students who are joining BU in the fall. 2.5 weeks ago, we were given very, very stringent guidance for the fall semester. MIT and Harvard sued, court battles happened. It was a very chaotic week in our office. And then the government decided to rescind that guidance, but they have not given us a full picture of what we're going to be permitted for brand new students. We are going to try to be as flexible as possible. We're working on a late arrival plan for students because we are operating the Learn from Anywhere program as a hybrid model. So we feel that we will likely be able to support bringing new international students in for the fall, but we're still waiting on that final approval. And so for those of you who might not be able to get here on September 2nd, we know there's lots of concerns around travel. There's still some travel bans in place. We're getting some really good news that some of the embassies and consulates around the world are starting to reopen, but we also know in the big embassies like India and China, we're still not seeing any movement with visa appointments. So we know that there are some real challenges for you guys being able to get here for September 2nd. We're going to be communicating with all of you via email. So if you're getting information from ISSO@bu.edu, pay really close attention to those messages. We're trying to respond to your individual questions as much as we can and as fast as we can, but we've been really overwhelmed in the last couple of weeks with all of your inquiries. So we do appreciate your patience. Please read the information that we send out, and please spend some time on the ISSO website, bu.edu/ISSO. We've tried to keep all of our information there as updated as possible. We have some FAQs for new students and continuing students, and we'll stay in touch with you over the next several weeks as we continue to learn more.
Thank you. Let me say a word about enforcement, because there's some questions about that. How are we going to enforce these expectations, these requirements? How are we going to make sure that we're all safe in terms of this? I want to break down 3 distinct sorts of paths that are important for you to understand. One is the notion that we will make sure that you are tested with some frequency, and also that every day you attest to any symptoms that you may or may not have. Those will be done via apps and communicating with you. A lot easier for us to hold you accountable from that standpoint, because we will know whether or not you've shown up or done the sorts of things that you need to do with regard to that. That's one aspect of it. Another aspect of it might be for those of you who live on campus in particular and are put in quarantine or isolation spaces. We will know, because of the type of space you're in, whether or not you're breaking quarantine or isolation, and we will address that as appropriate too. And when I say address it, the important thing to think about with testing, with attestation, with being in quarantine when you're asked to be in quarantine, or being in isolation when you're asked to be in isolation, the result is, if you cannot do those things with the frequency that we ask you to, over the time that we ask you to, then you can't be here, and we will ask you to go remote. Hopefully you will do that yourself, but if you cannot do those things, we will prohibit you from going to classes, attending activities, participating in the sorts of things that happen in person. So that's one aspect of it. Here's the harder one, and the one where we all have got to play a role in this. Those are the cases where we're talking about mask and face coverings and making sure that those are over your nose, your mouth, and your chin, in public spaces, in classrooms, in hallways and corridors, as well as physical distancing in those same sorts of spaces other than your room or your office space, and also making sure that you respect the number of people in capacities in places like the shuttle bus or in rooms or public spaces as well. All of those are the sorts of things that we'll post information, and where we will make sure that you have got to get used to it. You will enter a culture here in Massachusetts where things like physical distancing, wearing face covers, and respecting those sorts of capacity issues are very important. There are plenty of people who will nudge you on the campus about that, and you will probably nudge each other about it. However, if you are a frequent offender of these, if you will, we will ask you to leave a class. We will ask you to leave the campus if need be. We will ask you not to live here if that's the case too. I anticipate that amongst ourselves, we will ask each other to respect those sorts of things, because it respects your health, but it also respects the health of your faculty and your fellow students. So those will be the ways that we will deal with and address this. And I am hopeful, and I am really thinking that in my conversations with people, we will get through this and work with that quite well. So that's where we are with enforcement of these sorts of things. Now, I'm going to go around very quickly and ask each one of you if you have any particular issue that perhaps we should get to very quickly that we didn't address, or a frequent question that you may be being asked that you think that maybe you should say a quick word about. Dean Abnasia, let's start with you, please.
Okay, I think a lot of the questions have already been asked and addressed, and in the near future, we're going to hold an individual webinar for Shaw students. So at that point, we'll be able to answer any other specific questions you might have.
Thank you. Dean Chard?
Yeah, I would say the same thing. Many of the questions that some people I think are frustrated, we are not getting to detailed questions about individual programs. I think those need to be handled by individual schools and colleges, and we will certainly be reaching out to our students to host a similar webinar to be able to answer those kinds of questions.
Thank you. Anything to add, Dean Fazewski?
No, I think that's about it. Thank you.
Great. Amanda.
I would say for our international students, know that we are paying really, really close attention to what's going on around the world with consulates and travel restrictions. And we are making really, really big efforts to update our website, update our students. So please pay attention to your email and the website so we can make sure you have all the best, most accurate information, because things are changing so quickly right now.
Dean Young.
Yes, just a few things. The first is, if you have any questions, I know there are quite a few questions. I tried my best to answer them in the Q&A section, and I typed quickly, so I got through a lot of them. But if you have any questions remaining, shoot me an email at cfadean@bu.edu. Again, that's cfadean@bu.edu. And the second thing is, remember that my memo, my note, my email is going out next week, followed by the 3 school directors. And I hope that we'll be able to answer many of your questions. But seriously, if you have any concerns or questions, shoot me an email and I will tackle it as best as I can.
Thank you. Peter Smikowski.
I neglected to mention that kosher dining will be available. We have kosher vegan dining hall that will be open and available. Also, if students have elected to learn remotely for the fall semester and they choose to cancel their RLA, it's a residence license agreement. It's as simple as sending an email to the housing office.
Thank you. Dr. Platt.
I would just echo the sentiment to just pay attention to emails and news that's coming from us. We are trying to keep you updated. It's a lot of information. We recognize that, but our campus guides are updated. Our Back2BU website is updated. You can find lots of answers to questions there as well.
Thank you. And finally, Provost Kennedy.
Thanks so much. I would echo what the deans have shared, and just to reiterate that the premise is a return to residential education. And I think the schools and colleges have done a tremendous job about thinking about that and creating in-person opportunities for our students that come back, as well as unique ways of interacting for the students that choose to be remote.
Thank you. So I appreciate you all being here, and thank you for your time. I also appreciate our student government for helping to organize this. And so I'm going to ask all of my colleagues, get out of this Zoom right now, because I need to bring David Joseph in from our student government. David, come on in.
Hello, hello. How you doing?
Hey, how you doing? Where are you joining us from?
Yeah, so I'm actually right next to BU, up a little bit further on Commonwealth Ave.
Well, thank you, and good to see you. Why don't you go ahead and tell us a little bit about the new normal challenge that students should be participating in?
Sure thing. So the new normal challenge itself, it's been a progress put together by the Dean of Students Office, Student Government, Umoja, the Black Student Union, and Innovate at BU. A collaborative effort in order to help students with whatever happens on this campus as we come together. You've heard from all the different deans and provosts, and they've told us a lot of what's going on campus. But as you come back, if you have your own ideas, suggestions, and things that you want to see done on this campus, the new normal challenge is exactly that, a pathway specifically structured, 2 different tracks that you're actually able to submit your idea, get feedback, get help, and institute it upon this campus. There's a lot more information that's provided on the website itself, which will be posted on some slides later on, as well as in the chat. But this is just a means for students to get their own voice heard and to actually produce the change that they want to see on campus. And I can't stress that enough.
Well, thank you. Well, this is our final of 10 of these sessions. You heard that within the schools and colleges, they'll be doing additional sessions, so be on the lookout for that. I also remind you that a number of the things that you heard, whether it be guidance or information, advice, those are based upon public health and other considerations. We'll try to make sure that we keep you informed as we get new information. And it all goes without saying that we want to make sure that we are waiting with open arms for you to return. We won't hug you because that's not what you can do now, but we will welcome you back and want to make sure that you are back here. All the best to us all, and may we see manifestations of global health, of racial and other justice, and may we all see manifestations of peace. All the best, and I hope I see you, whether remotely and online or in person, very soon.